VOSM is a subspecialty group that emphasizes sports medicine, rehabilitation, regenerative medicine, and orthopedics for canines. It was one of the first sports medicine centers exclusive in the United States for dogs. When using regenerative medicine type technologies, we have two in particular that we reach for most commonly. We have PRP, or platelet-rich plasma, and we have what's called stem cell therapy. In particular, it's called BMAC, which stands for bone marrow aspirate concentrate. It's a bone marrow stem cell process that we'll use to obtain the stem cells from bone marrow. When we're trying to decide one versus the other, it depends on the underlying condition, once again emphasizing why diagnosis is so critical. There's a great synergistic effect between stem cells and PRP together, so if we're dealing with a very chronic condition or severe injury or soft tissue injury in particular, we'll always reach for that synergistic effect of PRP with our stem cells. It's really easy to perform PRP or platelet-rich plasma therapy in your canine patient. It's as simple as drawing a blood sample, spinning it down in a centrifuge, and which takes about 15 minutes, and then you're ready to perform your injection.
The reason to choose treatment with regenerative medicine, whether it be platelet-rich plasma or platelet-rich plasma with stem cell treatment, is it's proven to be pretty beneficial in these patients where they've been non-responsive to typical medical management, and we're able to use regenerative medicine in some of these soft tissue issues as well as osteoarthritis, and we've been able to generate a very successful healing response as well as motivate the tissues to want to heal, maybe in an area where the response to healing is lacking, or we've progressed to more of a chronic issue and now we need to re-stimulate and bring in growth factors to stimulate a healing response.
Aside from here at VOSM, where we use the CRT system, there's numerous locations of other specialty centers around the United States, universities, as well as general practitioners that are utilizing the CRT system for the treatment of osteoarthritis or soft tissue injury with great success.
At VOSM, we prefer to use the companion regenerative therapies or the CRT machine because it is very easy to use. It allows us to process samples same day in-house, and that way we're not having to send these samples out for culturing that come back 2 to 3 weeks later and then have to get the patient back in, do a second anesthetic or sedative episode. And then as far as following the steps along, the CRT machine is very easy to follow with very low chances of introducing any sort of complications or issues while we are preparing our platelet-rich plasma sample or our bone marrow sample for stem cell treatment.
As far as morbidity, patient concerns, patient processing, staff ease and usability, the CRT system hands down is much more user-friendly. When it comes to the use of any regenerative medicine technology in small animal orthopedics or sports medicine, it is absolutely critical that you make sure that the system that you're using has been validated for dogs. So in the ideal situation for platelet-rich plasma therapy, what we want to see is a significant increase or concentration in platelets, at least 5, 6, 7 times concentration, if not higher. We want to see no red blood cells in that sample, possibly an increase or at least steady rate of monocytes and lymphocytes, and no neutrophils in that sample following spin.
That's why we stand behind the companion regenerative therapy system, is because once we were able to validate it, we were finding that as of all the systems on the market, it gave us exactly what we wanted in a platelet-rich plasma machine. And then it also has the added benefit for us to process bone marrow for stem cells, which many of the other machines don't give you that ability to do.
The use of regenerative medicine treatments for canine patients has been really well accepted by clients. They love the idea that it's minimally invasive. They love the idea that it's very holistic. We're utilizing the body's own ability to heal. It's outpatient. These are very quick treatments as far as the process is concerned. You can come in, do the collection, do the processing, do the injection, and they can go back out and hit the road within a short period of time. So all in all, it's very, very successful as far as the acceptance of this amongst our clients.
Many clients, when you tell them that we can offer a non-invasive way that's going to get them off of taking a lot of medications, they're very, very open to those suggestions, knowing that if it were to come down to needing surgery or something of that nature, we can always resort to a surgical treatment option. But if they can get away with a more minimally invasive alternative, many of them are very, very happy to undertake that.
The reason I would recommend the companion regenerative therapy system or CRT system is because A, we know 100% it's validated for dogs. Not only the PRP, but also the bone marrow aspirate. Secondly, it's a price point that is affordable for our canine patients. It's not set at the price point that's still unfortunately out there in human medicine. Thirdly, it's multi-use, so we can actually use pure PRP, but we have the ability to also do stem cell therapy or regenerative therapy using bone marrow concentrate aspirate or bone marrow stem cells. And lastly, we have the data. we've performed hundreds of cases for osteoarthritis, soft tissue injury, including tendons and ligaments that we followed out objectively with objective gait analysis, musculoskeletal ultrasound, and return to function, meaning sporting and other types of performance activities where they've remained in the field and continued to do well. For us, it's given us a great ability to have another conservative holistic approach where there are no surgical options, and it's also given us a great way to augment our surgical approaches to have a better, even better outcome long term.